Hello and welcome to energetichealth.info. If you've been listening to me and if you looked at the past video, then you really understood that drugs and medication are really not the best solution for eliminating emotional pain and eliminating emotional disorders, or curing any emotional disorders. And actually, it's interesting to note that medication does not claim to cure anything. They only claim to control it or treat it. Because if they treat it, then you have to take the medication for the rest of your life. But if they cure it, then they're out of business. You won't have to buy medication, and then they won't have to sell it to you, and they won't make any money. So if you've already looked at my course, if you've already got my course, and if you went through the course and you suffered from any negative emotion, you probably were surprised at the results, because you probably were able to eliminate your depression in a matter of minutes. If you had a phobia, you probably eliminated in about 2 minutes, because that's the quickest thing to virtually cure or eliminate. If you had anxiety or panic attacks, eliminated them. If you had trauma, you probably cured them. Now, if you have not gotten my course, I strongly recommend you consider obtaining the course, because it is the most effective technology, the most powerful technology out there to really cure any negative emotion or any emotional disorder. Now, if you've bought my course and you've gotten great results, please email me your results. Email me your experience. What type of treatment were you doing before? What type of medication or what therapy were you using? And what results were you getting back then? Then let me know how fast was your anxiety or depression cured using the bioenergetic rebalancing techniques. And if you can send a video testimonial saying the results that you obtained and the results you got from the course, I would greatly appreciate it. I need some video testimonials. Now, I have a few things here that I want to touch on. A few articles, a few studies that were done. Now, if you have any questions at all, or if you have any concerns or comments, feel free to go to energetichealth.info, go to the contact section, and you can email me any question, any comment, anything at all. If there's a particular subject that you want to talk about, or you want me to talk about, email me and I'll make sure to touch on that subject. So, panic attacks and anxiety are linked to low vitamin B and low iron levels. So, a study done in Japan identified that all the people who were experiencing panic attacks or hyperventilation attacks, they actually had either a vitamin B6 deficiency, or they had low iron levels, iron deficiency. It was either one or it was both. You see, I've always said this. Emotional disorders such as anxiety and depression are not caused by a lack or a deficiency of medication. It's not caused by a deficiency of Xanax or whatever the medications are that they're selling right now. They are not caused by that. If you want to cure something, you need to fix the cause of whatever's causing it. If I hit myself with a hammer on my hand, and then I go to the doctor's gonna give me pain medication. It's gonna be like, oh, take this painkiller and your hand's not gonna hurt. So he cured my pain. But if I keep hitting myself with a hammer, and then I go to the doctor and I say, doctor, my hand hurts, it's bleeding, it's just, I'm in pain, cure my pain. And the doctor's going to give me stronger and stronger and stronger painkillers if I keep hitting my hand with a hammer. Now, that's probably alleviating the symptom because I may not feel any pain. I may not feel the pain of hitting myself with a hammer. But what happens is that the condition is going to keep getting worse and worse and worse. If I keep hitting myself, it's going to keep getting worse because I'm not fixing the cause. Now, what's the cause of all negative emotions? What's the cause of emotional pain and emotional disorders? I've said this many times, and the only cause, or the root cause of all negative emotion, of all emotional disorders, is an imbalance in the body's energy system. And what's causing the imbalance in the body's energy system? It is negative information stored in the body's energy system that's actually causing the whole energetic system to go out of balance. Now, if you go to medical science, they say, oh, low serotonin causes depression. Chemical imbalances in the brain cause anxiety and panic attacks. So they give you these chemicals to balance the chemicals in the brain. You see, the chemical imbalances in the brain are not a cause. They are a symptom. A symptom that is just like having a panic attack. A panic attack is a symptom, but imbalances in the brain are also symptoms, and they are symptoms caused by imbalances in the body's energy system. You see, the root cause of all emotional disorders, of all negative emotion, emotional pain, is information stored in the body's energy system causing it to go out of balance. Now, this is something that medical science is just not putting in medical schools. Another study shows that a diet high in antioxidants helps banish anxiety, stress, and depression. So, you see, there are so many studies showing that nutrition does affect the way you feel. It does help improve your emotional disorders. It helps cure, because lack of nutrition or nutritional deficiencies are really a contributor to having emotional disorders. Now, they can be cured if you cure the main cause, which is eliminating the imbalance in the body's energy system. That's the main cause. If you fix that, then the rest is going to be fixed. Now, it does help to have a good nutrition. And the study goes on to say that a medical study done in India conducted on 80 people. They were between the ages of 20 and 60 years old. And all the people who were experiencing a general feeling of depression and anxiety were found to have low levels of vitamin A, vitamin C, and vitamin E. Then after 6 weeks of being treated with certain doses of vitamin A, vitamin C, and vitamin E, the condition was completely, or not completely, but significantly improved. So after 6 weeks of nutritional therapy, they were able to feel much, much better. Now, this doesn't happen with any drug. This doesn't happen with medication. The opposite happens. The conditions get worse and worse and worse and worse because you're not addressing any of the causes. You're only suppressing the symptoms so that you're not aware that you have them. But you see, the main cause is an imbalance in the body's energy system. But also a contributor to that is nutritional deficiencies. So they're treating a minor cause and they're getting results because they're treating the cause. Now that's why it takes so long. It took them 6 weeks using nutrition to basically improve the condition, significantly improve it, so they probably felt much, much better. But it took them 6 weeks. Now, compare that to medication. It takes months and months and months and months and months and even years of taking medication constantly, and the condition never improves. It only is suppressed. You may not be aware of the symptoms, you may not be aware of the condition as long as you take the medication, but that's because you're being numbed, so you don't feel the effects of it. You're being numbed and the symptoms are suppressed. They're not being improved, they're being suppressed. So as soon as you stop taking the medication, they come back immediately and they come back even stronger. So that's the difference between nutrition and medication. Now, if you were to use, for example, the people who had anxiety, if they were to use the anxiety cure from energetichealth.info, they would be, at least the majority, would be able to cure their anxiety in a matter of minutes. Now compare that to 6 weeks. 6 weeks is good, but compare it to 10 minutes, it's much, much better. People who had depression, by using the depression cure from energetichealth.info, they would have cured it in minutes, hours, maybe a day. You see, the differences are dramatic. Big, big differences. Now another report talks about Prozac. So it talks about how there was a 400% increase of antidepressants, or of use of antidepressants, from 1994 to 2008. So in 2008, 4 times more people were taking antidepressants than in 1994. And today, it's even worse. And it's getting worse and worse and worse and worse. And every year, it's going to get worse. More and more people are going to be on psychiatric medication. If medication really is so effective, if medical science is making so many advances, and they're having so many breakthroughs in science in the treatment of emotional disorders, then why is it that more and more people every year are being diagnosed with some kind of disorder? More people every year have to take antidepressants, anti-anxiety medication, or some kind of psychiatric drug. Now it goes on to say that 1 in 5 women between ages of 49 and 59 use Prozac, and 4% of adolescents are taking antidepressants worldwide. So it's not only in America, but now it's a worldwide phenomenon. And the sale of antidepressants totals over $20 billion a year. So it's a big business. You see, this is a big business. Selling antidepressants, selling psychiatric medications. It's a billion-dollar business. If you're cured from depression, if you're cured from anxiety, you're not going to need antidepressants. You're not going to need Prozac. So these people are going to lose billions of dollars in sales. Their job is to make sure you take medication for the rest of your life. Their job is to make sure you take Prozac for the rest of your life. And if you take 2 or 3 medications, 2 or 3 drugs, even better for them. And many people don't know. Many people don't realize that the drug companies are actually putting or controlling medical schools. So whatever your psychiatrist, whatever your psychologist, or any doctor knows, it's being taught to them by the drug companies. They are putting the information into the medical schools. And you think they're gonna teach doctors how to cure depression effectively? You think they're gonna teach them how to cure anxiety? If they teach that in medical school, then no one's gonna have to take Prozac. Now let's look at some of the side effects of Prozac or antidepressants or anxiety medication. Some of the side effects are sexual dysfunction, insomnia, fatigue, nausea, blurred vision, constipation. And now this is a very interesting one. It causes restlessness, anxiety, and agitation. So you take anxiety medication because you're restless. You take anxiety medication because you have anxiety and you feel agitated. And now the same drug that is supposed to treat the symptoms is causing restlessness, is causing anxiety, and it's causing agitation. So drugs are causing the very same symptoms that they're supposed to treat. And they've also been linked to increased suicide rates. So if you have depression and you're taking Prozac or you're taking some other medication, you have a increased chance to have suicidal thoughts and actually commit suicide. Now, Jane Faust, a Canadian neuroscientist, found that microflora of the gut have a significant connection with the central nervous system. So the study goes on to say that taking probiotics can help reduce anxiety and depression. So again, it's just like taking vitamins. If you have depression, if you have anxiety, you have, depending on how severe it is, you have definitely, because this is the main cause, you have an imbalance in your body's energy system, which is caused by several factors, but doesn't matter because there's an easy way to rebalance your body's energy system. There's an easy way to bring your energy system back into balance so everything else gets automatically fixed and your depression, your anxiety, your trauma, your negative emotions, your addictions are eliminated. So probiotics help reduce the symptoms of anxiety and depression. Not only do you have an imbalance in your body's energy system, but you also have nutritional deficiencies and you have toxins in your body which are causing the negative emotions. Now, there's a study talking about the benefits of chamomile. And the study goes on to say that this is obviously one of the most popular herbs, and it's the first or one of the only herbs that has been recognized by mainstream medicine. So they actually recognize and they agree that chamomile has many effects on the body. It has many positive benefits. It goes on to say that it's popular for helping with stomach ache, relaxing nerves and anxiety, and for treating insomnia and many other conditions. It gives me a list of about 50 things that chamomile is good for. Now, chamomile helps reduce anxiety, helps reduce depression, and it helps reduce most negative emotions. It helps you calm down and it helps you with stress. So it's a very beneficial herb to take in a tea. You can buy chamomile tea. Now, another study shows that prescription anxiety drug abuse is tied to rising numbers of deaths and more ER visits, and has doctors retreating. So basically the study goes on to say that doctors are now thinking about not prescribing so many anxiety medications because so many deaths are being caused by taking these medications in abuse, so overdosing, and also more people are visiting the emergency rooms because they are taking anxiety medication. So investigators with NBC's New York affiliate disclosed that the abuse of prescription anxiety drugs, especially Xanax, along with other medications, has caused a 50% rise in ER visits. So 50% more people are visiting emergency rooms because they're taking anxiety medication. Something to consider if you're taking anxiety medication. Now, if you take anti-anxiety drugs, I don't recommend you suddenly stop and not take them, but go to a different doctor. Go to a doctor who can help you get off the prescription medication, the Xanax or whatever other psychiatric drug you're taking. Now, doctors are acknowledging that anxiety medications work well for a acute panic attack. So if it's a small panic attack, anxiety medication is good. It helps relieve or stop the panic attack. But the doctors also say that it's not good for long-term use, or it's not effective for long-term use. So if you decide to take a pill every time you have a panic attack, yes, it's going to reduce the panic attack, or it's going to stop the panic attack. But it's not going to treat your anxiety. It's not going to cure you of anxiety. It's not going to reduce the frequency of the panic attacks. And it's not going to reduce your general anxiety. And in fact, people who use anxiety medication report that long-term use of the drug makes the condition worse. So if you take this medication, yes, you take a pill every time you have a panic attack. It's good for that one time. But then continuous use doesn't make the condition any better, it makes it worse. After long-term use, the condition is going to get worse and worse and worse. It's not going to get any better. And that's because the cause of the condition is not being treated. And if it's not being treated, it's not going to get any better, and it could possibly get bigger or get worse. Now, by taking toxic drugs that are toxic to the body, which is all prescription medication, it's going to cause you to make it worse because it's affecting your body in an unnatural way. So you see, these things only make the condition worse and worse and worse. Now, if you suffer from depression, if you suffer from anxiety, if you suffer from any other condition, what can you do? There's a few things you can do. You can eliminate junk food from your diet, eliminate fast food. You can improve your diet, improve your nutrition, take a whole food supplement, eat more fruits. That's certainly going to improve your condition. It's going to make you feel a lot better. But it's going to take quite a while, and it's not going to cure your condition. If you have an emotional condition, the real cause, the main cause is, yes, it's an energetic imbalance in your body. An energetic imbalance in the body is, in the past, it had been very, very hard to even identify. It had been very hard to even know that this was the cause of the emotional disorder, of the emotional pain. But today we know this for a fact. And not only that, but there is easy ways to correct the condition. There are easy ways to tap into your energy system and correct it. To, in minutes, fix the problem. In minutes, rebalance your energy system. There are techniques you can use which are not hard. You don't have to study for hours. You don't have to even know anything about it. You simply have to look and repeat, because my DVD program takes you virtually by the hand and walks you through the process. All you have to do is repeat everything you see, and your energy system is going to be corrected. It's very easy to do. I recommend you go to energetichealth.info, energetichealth.info, to get more information about my DVD programs. There's a program specifically for depression, a program specifically for anxiety and panic attacks, specifically for phobias, addictions, post-traumatic stress and traumas, and there's a general course that teaches you the techniques so that you can use them anytime, apply them on other people. But there's really nothing else out there that has the same benefits, gives the same effect as this program and these techniques. Now, stay alert for your next email for when I send you my next video, and I'll see you then. And remember to go to energetichealth.info. If you haven't subscribed to my group, if you haven't subscribed to my list, go to energetichealth.info and enter your email address in the box. energetichealth.info. There's an opt-in box. Simply put your email and I'll be able to send you information, send you videos on how to be emotionally healthy. So I'll wait for you on the next video. I'll see you then.